Can you please confirm that we are on full screen? Perfect. Well, good morning. It's 11:02. Good morning. Before we get started, I want to acknowledge everyone who is listening to us live via YouTube or Facebook. Please know this event is being recorded and will be posted in our social media platforms, Facebook, LinkedIn, and the YouTube channel. Our information today is in English. However, if you prefer or know someone who needs this information in Spanish, please let them know that we have one more session at the beginning next Friday at 11 a.m. So whether you are new to Medicare or you are looking to change your Medicare Advantage, this broadcast will help you provide with important information about Medicare options that may help you make an educated decision and support your evolving lifestyle. Hello, my name is Claudia Delgado. I am the Director of Business Development at Florida Insurance Solutions Group, and I am here to talk to you about the options available to anyone with Medicare. First of all, if you're turning 65 years old, congratulations. What a major milestone. We thank you for being here today. You will learn about what to expect when you turn 65, learn about Medicare in general, what Medicare supplement plans are, Medicare Advantage plans, Medicaid assistance programs, how to know if you should stay with or if you should switch a plan. As part of bringing our customers the best there is to offer when it comes to the selection of their health plan, an important part of the decision process is also the selection of a good doctor's office where they can receive the health benefits. That's why I'm pleased to have Al Palombo, the Chief Marketing Officer of ClareMedica, with us here today. ClareMedica is a physician practice group with practices throughout the state of Florida that offers our Florida Insurance Solutions Group customers excellent primary care. A little later in the presentation, I will be providing us with the information about the benefits of being a patient of ClareMedica. Great, so let's learn about Medicare. What is Medicare? Medicare is insurance for adults 65 and older and for those with a qualifying disability. It's paid for in part by the federal government, payroll taxes paid by the employee, and employer. Medicare is an individual insurance policy, so each person must apply or qualify to be covered, and it is certainly different than group insurance, a traditional employer group plan policy, where you usually can add or include your family. Keep in mind, Medicare is not a one-size-fits-all, and it is different from Social Security, although you may pay for some of your Medicare premiums out of your Social Security check. These two programs are entirely different. Did I say premiums? Yes, that is correct. Medicare is not free. You see there are premiums and cost share on top of the taxes that you already paid. Who can get Medicare? There are eligibility requirements, and that is if you're 65 years old or younger, if you have a qualifying disability or qualifying medical conditions such as end-stage renal disease or ALS may qualify you to get Medicare as well. In addition, to be eligible, you must be a U.S. citizen or a legal resident for at least 5 years in a row. What original Medicare Parts A and B cover is as follows. Part A covers for inpatient hospitalization, skilled nursing facilities, meals while in the hospital, and nursing care while in the hospital as well. Medicare A is premium free for most people if you or your spouse have worked in the States and pay taxes for a minimum of 10 years. Keep in mind there is a deductible for benefit periods during any inpatient hospitalization under Part A. Different than Part A, Medicare Part B does have a monthly premium that is adjusted based on your income. There is also an annual deductible, and then you have a 20% cost share or co-insurance. That means that after you meet the deductible, you will pay 20%, and then thereafter Medicare cost share, it's 80%. They pay 80%. It is important to know if you do not enroll in Part B when you are first eligible, you may see a penalty if you enroll in the future. To avoid that penalty, you want to ensure you have credible coverage such as group health insurance or individual health insurance through the marketplace. Medicare does not cover everything. It is important to remember that. There are out-of-pocket costs for you, and it does not cover prescription drug coverage, does not cover for vision, dental, hearing aids, and other services. Because Medicare does not cover everything, you may be seeking for additional coverage. Here are the names of programs that can in fact save you money. Medicare Advantage programs, Medicare supplements or Medigap, prescription drug plans. According to Medicare Consumers Report, a Medicare beneficiary saves on average $750 a year on prescription costs alone. To learn if you too can save money on your prescriptions and much more, contact Florida Insurance Solutions Group to speak to a licensed representative about many or any of the Medicare options, including dental, vision, and health insurance plans listed in here. Who is Florida Insurance Solutions Group? Is a health insurance agency who contracts with most major plans in the area with over 30 years of experience, combined experience in the industry, a broad portfolio of products, including access to helping you find the healthcare provider you need. Florida Insurance Solutions offers you guide to not one, but multiple health plans. So call the number on your screen to get your questions answered. The companies you see on the screen all offer Medicare Advantage programs that include prescription drug plans, also known as Part C. Returning to Medicare options, Medicare supplements, also known as Medigap plans, are one alternative to supplement your Medicare cost share. That means you keep a Medicare, plus you purchase a Medicare supplement insurance, and in addition, most people will purchase a prescription drug plan to cover for medications. Enrollment in a prescription drug plan is not required. However, if you delayed enrollment in enrolling in a prescription drug plan and do not have a credible coverage, there could be a penalty. There is a penalty that CMS or Centers of Medicare and Medicaid Services will assess for not enrolling when you first become eligible. So even if you do not take medication, you may want to seek this option. Medicare supplements can be used across the country, and you may use any provider that accepts Medicare. That is an excellent benefit that many choose to select. Medicare Supplement plans offer several options, and depending on the plan that you enroll in, they come with a high premium. If you signed up for the first 6 months of your Medicare becoming effective, you have a guaranteed issue, meaning there is no health questions asked to enroll in a Medicare supplement. Keep in mind, if any of these programs is not an automatic enrollment, you have to take action. And in order to make an educated decision, stay tuned and I will show you why it may be smart to consider an all-in-one Medicare Advantage plans designed to give you a more complete health options to keep you get well while you potentially can save money. Many plans provide broad coverage, and these soon may start to save you money on monthly premiums and prescription drug coverage. Medicare Advantage plans are affordable, all-in-one plans that help you cover Part A, Part B, and Part D. They help you pay for hospital stays, emergency care, doctor's visits, and they also include prescription drug coverage. In addition, here's what you get with an all-in-one card that's being offered by Medicare Advantage plans. Prescription drug plans, or Part D, coverage for doctor's visits, hospital stays, preventive care. Many save you on dental and vision. Medicare Advantage plans come in several forms. You have them in Health Maintenance Organization, or HMO, Preferred Provider Organizations, or PPOs, or Private Fee-for-Service, PFFS. The difference here is the network. The network of providers contracted by the plan to render medical services. You should ask if your doctor is in the network of providers. Medicare Advantage plans provide you with extra coverage that you may even consider changing your provider if he or she is not in the network. The formulary varies from plan to plan. You should ask a representative always if your medication is covered. Is dental and vision important for you? If so, how much does it cover? Last, several value-added services are included in each plan that is worth reviewing your needs. For people that need extra help, you should contact a Medicare office, Social Security Administration, or your state Medicaid program. There is available extra help, and as a matter of fact, an agent from Florida Insurance Solutions Group can help you obtain information about extra help and even help you qualify if that's what you need. Here we have some important dates to remember, and those dates are the annual enrollment period that we are at the moment. That started in October 15, and it ends in December 7. Anybody with Medicare can make as many changes as you like, and the plan usually becomes effective January the 1st. The OEP period that starts in January 1st through March 30th, you can make a one-time change if you have currently a Medicare Advantage, if you're currently enrolled in a Medicare Advantage, and for whatever reason you need to change it, and it starts the first of the following month after your enrollment. In addition, you have special election periods, or SEPs. This goes on the rest of the year. The rest of the year means that if you move out of the service area, or if your coverage ends, there are several election periods, special election periods that may qualify you to enroll in a Medicare Advantage. Once again, you have a Florida Insurance Solutions group to help you out and guide you over any of these options. With that, I am pleased to come to a conclusion, to an end of our presentation. Hopefully the information that was provided here today was informative enough to help you make an educated decision. I am going to leave you with our webpage and asking you to follow us on our social media at FISG.agency for additional information, including events that are happening in the following days. I am pleased to have Al Palombo, Chief of Marketing Officer of Clare Medica, with us here today. Clare Medica is a physician practice group with practices throughout the state of Florida. And today he is here to talk to us about Clare Medica and its excellent primary care. So allow me to bring Al into the room. Good morning, Al. Can you hear me?
I can hear you. Can you see me?
I can see you as well, yes.
And do you see my slide presentation on your screen?
Yes, absolutely. It's right there.
Great.
Thank you very much for being with us today.
Oh, no problem.
I am going to go ahead and give you the floor.
Thank you so much. Thank you. And good morning, everyone. Thank you so much for joining us here today. I really appreciate it. As you can see from Claudia's presentation, there are a lot of things to choose as it relates to receiving Medicare, and the good people at her insurance agency, Florida Insurance Solutions Group, can help you navigate the complicated world of Medicare and choosing the right Medicare plan for you. So I would highly encourage you to reach out to Claudia and her team if you have any questions about Medicare and what's the right plan for you. As Claudia indicated, my name is Al Palumbo, and I'm the founding partner and chief marketing officer of Clare Medica Health Partners. And Clare Medica is a medical practice group that specializes in providing primary care to Medicare eligible individuals throughout the state. I'm honored and delighted to be here with everyone today. And again, thank you, Claudia, and our good friends at FISG for organizing the presentation today. You know, during this time of COVID, like many of you, I've been cooped up at home for the better part of 7 months, doing my best to keep my work life and my personal life balanced. And so it's a very peculiar time. So these types of presentations, any kind of presentation, is a real pleasure and a treat for me so that I can speak to and listen and meet new people. Today, I'm going to tell you a little bit about the Clare Medica group of primary care practices and why I think you should become a customer of our little organization. So let's get started. On this slide, we really sum up nicely how we operate. In short, we are professional primary care providers that deliver care primarily to Medicare eligible people in the state of Florida. Simple as that. We're not in the nail business, we're not in the hair business, and we're not in the snack business, as you might see in other clinics. Our total focus is on taking care of the health and well-being of our customers. And you'll note that I used the word customer here and in the previous page. We learned a long time ago that the best way to build a trusting, loyal relationship is not only to provide great medical service, but also a great customer experience. If you want to be successful in any business, healthcare is no exception. You have to provide for an excellent customer experience. We currently have over 50 owned and affiliated practices to serve you. A list of all of our locations and providers is available on our website, www.claremedica.com, and that's CLAREMEDICA.com. And while we are a family practice, our specialty is in taking care of seniors, those who are 65 years or older or under 65 with certain disabilities, as Claudia indicated in her presentation. What's important is that you have a Medicare card, and that's the red, white, and blue card that you receive from Medicare. We accept original Medicare, so the traditional Medicare, or what Claudia mentioned earlier as the fee-for-service Medicare, as well as most every major Medicare Advantage plan in the state, also known as Medicare Part C, through an HMO or a PPO. As you see here, we have a lot of plans in our system, but not all plans offer benefits in all counties. Depending on where you live, we can help you find the plans that are available to you in our practices. A little later in the presentation, I'm also going to introduce you to the contact information of Beverly Simons, who can help you identify the plans, the appropriate plans for the region that you live in. Here's a map of our current footprint in Florida. As you can see, we have a concentration in South and Central Florida, and we intend to continue our expansion throughout the state. Another thing you'll notice on this slide is that we have made a differentiation between owned and affiliated offices. At our owned offices, you'll see our signage, our materials, and our logos, as these are offices that we own and operate, and there are over 110 trained ClearMedica associates throughout these offices, ready and willing to help you with all of your healthcare needs. Affiliated are top quality doctors' offices that ClearMedica has contracted with in order to provide our customers with greater access to the care they need through a broader network of providers. In the end, it's all about the quality of care, and no matter which location you choose, you can rest assured that you will receive better care, better service, and better quality of life for you. As an added service that is completely free of charge to ClearMedica patients, we also have a dedicated practice marketing coordinator, Beverly Simons. She's the person I mentioned earlier. Beverly works exclusively for ClearMedica, and her job is to help our customers find just the right practice location and just the right Medicare Advantage plan partner that best suits their needs. Beverly knows everything there is to know about Medicare and can help you find the information you need when learning about Medicare benefits and eligibility. Beverly can also help you find an insurance broker like the good people at Florida Insurance Solutions Group, who can help you get signed up with a Medicare Advantage plan of your choice. So let me tell you a little bit about our philosophy of providing care. If we start at the top, with the top goal in mind, which is a happier, healthier customer, we've learned that the recipe for success in this equation is to provide the providers, if you will, all the resources or solutions they need to do what they were trained and like to do, which is to have a singular focus on their patient and deliver the best care possible. We provide the resources and support they need to do their jobs. And how did we learn about what keeps customers happy? Well, we learned by asking what was important to them, and here's what they had told us over the course of many years. We learned that they want to be understood, not patronized. Our customers are senior citizens, not children. We learned that our customers want to feel good when they come into our practices. They want a place that's welcoming. They also want to know that they're in good hands and can trust the advice they receive from our professional providers. The older our customers get, the more they want to feel safe and comfortable in our practice locations. The world for some of our older patients with vision or hearing or ambulatory impairment can be a scary place. So when they walk into our offices, we want them to breathe a sigh of relief. And finally, and perhaps most importantly, they hate waiting times in the exam room. That's why we've instituted a check-in, check-back policy, because not everything flows like clockwork in a busy medical practice. But we found that when you inform your customers about what's happening or why a provider may be delayed, or even empower them to make a priority next appointment if there's a real backup in the practice, they are much happier and report an overall better experience. We know this because we undertake real-time surveys after each appointment, which allows us to do what we call a service recovery to make sure that our customers' needs are attended to. Now let's meet some of our providers. As an example of the quality care you can expect from our team at ClearMedica, let me provide you with an introduction to one of our doctors in our South Miami office. Here you see Dr. Ramon Leon. He's been a physician for almost 25 years and began his focus on senior care 14 years ago when he joined Southdale Primary Care, which is now a ClearMedica practice. With his background as a staff physician at two of the largest hospitals in the region, Baptist and South Miami Hospital, he is a mainstay of the South Miami community and is fully bilingual in English and Spanish. As you can see from his picture, he's very charismatic, has a great sense of humor, and is very engaging. And that's the way it is with all of our providers in our practice. Throughout ClearMedica, we've got a great team of providers standing by to help you with just about any healthcare need you have. If we don't know how to fix it, our team will know someone who will. And we speak many languages in our offices, including English, Spanish, Creole, Russian, German, and funny enough, several Indian languages such as Hindi, Telugu, Kannada, and as well as Tamil. What you'll see at our practices are smiling faces and people you can count on every day at ClearMedica. When you arrive at ClearMedica, you arrive in a practice that's clean, safe, and friendly. So I hope you can see at ClearMedica, we'd like very much for you to be part of our family. What I encourage you to do is feel free to give Beverly Simons, whose number you see on the screen now, a call, and she can arrange a tour for you at any one of our practices. She would love to show you around and introduce you to our wonderful people. So with that, Claudia, that's the end of my presentation. I'd like to know if there's any questions, or is there anything else I can inform your audience about?
Thank you very much, Al, for such a wonderful presentation. It is definitely very important for a patient or a Medicare beneficiary to know the options about great medical groups available in the area. So it's great, the information you presented. Thank you very much for posting the information there. We also placed it in the chat.
Great.
There are a couple of questions I have here, Al, that I have. It says I have my own insurance option and I don't want to change it. Can I still belong to ClearMedica?
Oh, that's a great question. So the answer is yes. What we've have tried to do is partner with as many of the major Medicare Advantage plans in the state. So the nice thing is that you can continue to see your specific doctor within our practice, but then choose any one of the plan partners that are available in the state. And one of the nice things about the relationship with Florida Insurance Solutions Group is that they can help you find any one of those plan partners if you decide you want to make a change, or if you decide to enroll for the first time in a Medicare Advantage plan. The nice thing is that you stay with us and get the opportunity to shop as many of the plans that are available.
That is correct. And the great thing to know is that you have many options, correct? Many options.
You bet.
Another question will be, if you could mention ClearMedica's top reason why someone will join the group, what would it be?
Well, you know, I think what I hoped in our presentation is you'd hear the word customer service, and we really try and focus on what we call a great patient encounter or patient experience. From the moment that one of our patients calls our practice or comes through the front door, what we really want them to do is I want them to feel at home. I want them to feel like they're with family and that they're in a place that they can trust to receive the best care possible. I want them to understand that we're going to take care of them like we would take care of our own family. And I think from the amount of surveys that we take and the people we engage with after their appointments, that's one of the top drivers. One of the things they like the best about our practices. It's the level of service and commitment we have, in addition to providing fantastic care with very smart doctors and nurses. It's the level of service that they get at our practice.
Thank you very much, Al. I don't think we have any other question at the moment. I just wanted to mention that it is a pleasure working with ClearMedica and yourself. We appreciate all of the support here for your time, specifically to help us educate the community. And for anybody out there, it's definitely the time to ask the right questions, whether it's now or after the presentation. We are eager to answer your questions. The phone number is posted right here, and we'll place it one more time. The video is recorded, and it's going to be placed on social media links for anybody to see and share. But please don't forget that you do have options, and we want to be able to inform you and provide you with the right answer, the right question, answer your question accordingly.
You bet. It's great working with you.
We are licensed agents, and we are professional individuals, and we want to be able to help you out. So that is it. It's 11:30. Great presentation, Al. Thank you again for being here today.
Thank you. What a pleasure. Thank you.
Have a wonderful Friday afternoon and weekend as well.
Great. Thanks, Claudia. Take care. Bye-bye, everyone.